I'm Xiaoyan Wang, and Chunhua from Columbia and I started this group just a month ago. This is probably the youngest work group, so we are really new to the community. So both of us have done some research in the past in the area of rare diseases, and we found, the fact that data is always rare, evidence is always rare. There's so much unknowns in rare disease spaces, and OHDSI will be the beautiful platform to support all that. So this is our mission statement. So pretty much we will focus on to understand the disease better. As you probably know, most of the rare diseases, we don't know the natural history of the disease. We don't know what are the symptoms, signs really triggers the screening process or the diagnosis process, and then treatment, disease progression, lots of unknowns. So our purpose will be try to see if we can really advance the understanding, diagnosis, and treatment of the rare diseases using the tools and data and methodologies and collaboratively. Three keywords here. The first thing is technologies, methodologies. So we're going to focus on some of the technologies to see if we can help to the evidence aggregation. The second one is average generation in the multi, studies and across different institutions to bring all the silos in the data. The third one is collaboration, because we found out, researchers in the field and also clinicians, patients, regulatory agencies, all silos in different spaces. We want to see if we can really make the translation across the community, really brought what we've done in the research community to impact in the real world settings. Next, please. So based on the mission statement, this is our objectives. The first one is being, because we are new, we really just starting the community. So the first one is really building the community and also to strengthen the community engagement. So our goals being we want to recruit active members and also to have a couple of knowledge sharing sessions to see what we can do to break the disciplinary across different space. And the third one, of course, we want to really build the partnership across different domains. So thank you, Greg and Alyssa, Andrew, a couple of others help us on the survey part of it. So we actually had an interested survey across the community. We got a very strong response. 44 people responded with a lot of comments on how we really make it successful. So just a couple of things. It's a very diverse community. As you can see, 37% of those come from academic, and then the next one is coming from, consultants, technologies, and researchers, clinicians, and patient advocacy group. So it's a very diverse group. The second question, we have a lot of other questions asked, but the second question also, what kind of resources, data, really, everyone can bring to the community. And quite some of those people have, data or expertise or research in different areas, in the technology, clinical expertise, and all that. So we think we are on the right trend of building this community right now. So thank you. Next one, please. So the second objective is we want to really run at least one user cases to see if we can enable scalable and reproducible evidence generation across rare disease areas. So we're gonna start the discussion on the disease picking and also institutions to really run that to see if we can really standardize the process. And also we're going to release our methodologies and the standard framework to that at the end of the year. So that is the second objective. The third one is methodologies. We want to see, because I'm an NLP scientist by training, so we really want to see, and most of those, we've been saying, NLP world, we've been saying 80% of information existed only in the unstructured way. In the rare disease space, it's 95% of clinical information on the diseases in the unstructured way. So we really want to see technologies such as NLP, large language models can break those areas. Same thing also knowledge graph, because the understanding of the disease, evidence of the disease across different resources such as, clinical data, literature, patents, and social media platforms, all that. We want to see we can generate knowledge graph across all those domains to really accumulate evidence for rare diseases. So we want to see if we can release the best practice using these technologies in the rare disease space by the end of the year. So this is our third objective. Next one, please. We're going to have our kickoff meetings this Friday because February 28th is kind of, the Rare Disease Day in a lot of spaces. And NIH, FDA have been really, running a lot of things on that day. We also have the meeting in the morning, 10 to 11, 28th this Friday. We try to accommodate, because quite some of the responders coming from Europe or different areas, so we try to cover those time differences here for this meeting. So please join us if you are interested in rare diseases.